Do you or your loved ones are suffering due to uterine fibroids and are having pain abdomen or heavy menstrual bleeding? Then you should definitely watch this video. Hi, I am Dr. Arjunlokesh, consultant vascular intervention radiologist, MIOT Hospital, Chennai. So, what these uterine fibroids are? Uterine fibroids are benign, non-cancerous growths within the uterus of the women of the age group between 30 to 50 years old. These non-cancerous benign growths would cause pain abdomen to the females or even sometimes heavy menstrual bleeding. So, how do we treat it? Traditionally, there was a surgery called hysterectomy or removal of the uterus where the uterus is entirely removed. But in the present era, many of our women won't prefer removing the uterus in total. Yes, why would anyone remove their part of their organ and throw it away when non-invasive or minimally invasive effective treatment is available? Yes, that is uterine artery embolization. Uterine artery embolization is a procedure which lasts about 45 to 60 minutes max, where a small pinhole is placed in the groin and a small catheter or microcatheters are taken through the blood vessel up to the uterine arteries and embolic particles are injected. These embolic particles are tiny particles which would go and block the blood supply to the fibroids. Once the fibroids are devoid of any blood supply, they would gradually shrink and die and necrose. Once these fibroids shrink in size, the women won't have any pain or and also they will have decrease in the or even disappearance of their heavy menstrual bleeding. Uterine artery embolization is a procedure to treat the fibroids in the uterus without having the need to remove the uterus in total. The major advantages are the first and foremost being super fast recovery. The patient will be able to go home within 48 hours from the day of the procedure and will be able to carry out all her daily activities without any trouble. The second advantage is the uterus preservation itself. The women need not worry about any hormonal imbalance issues later in life. The third advantage being avoidance of a major blood loss. In contrary to hysterectomy, where there is or perceived to be significant blood loss, uterine artery embolization offers zero to minimal blood loss. The fourth advantage is being the effective symptom relief with uterine artery embolization. There would be a significant reduction in the pain or even heavy menstrual bleeding once the fibroids starts to shrink in size. The fifth advantage is when even in this uterine artery embolization works even in cases of multiple or large fibroids. In those cases also, a single uterine artery embolization procedure would take over all the fibroids and decrease their sizes. And last but not the least is there is no stitches or scars, which is providing a scarless treatment as opposed to a invasive surgical treatment.